Whooping cough is on the rise in Texas, with the state reporting over 3,500 cases. Thanks for joining us. I'm Daniel Marin.
And I'm Jennifer Sanders. Cases have increased nearly 4 times compared to the same period last year, with 85% of those cases being from children. Our Adam Schwager looks at the reasons for the increase and what parents should know.
We see years of high pertussis cycles, but this is definitely one of those years with more pertussis cases.
Cases of pertussis, more commonly known as whooping cough, on the rise in Texas.
It may start just as a normal cough, but the key thing is that it causes these episodes where the child is just going to start coughing and not be able to stop.
One of the key symptoms to look out for?
They're going to make this kind of sound, and so that's them trying to breathe.
According to Southeast Texas Dr. Leilani Valdez, who also serves as a spokesperson for the College of American Pathologists, a couple reasons could exist for the rise in cases.
We are seeing the rise in these cases as a direct result of the lower vaccination rates in our communities, not just in Texas, but across the country.
According to data from the Texas Department of State Health Services, when it comes to the Tdap vaccines, which include pertussis, over 6.5% of Texas 7th graders and over 7% of Texas kindergartners are unvaccinated. About half of those unvaccinated listing conscientious objection as their reason. However, vaccination rates amongst children is just one piece of the puzzle.
It's recommended that all children and adults get a 10-year booster. We're seeing not just a drop in initial vaccination rates, but we're also seeing a drop in people getting that 10-year booster.
In Austin, I'm Adam Schwager.
And in a release, CVS Health said it's offering the vaccine across the state at its Minutes Clinic and CVS Pharmacy locations.